I'm kind of at the cusp of changing my forte or my love for the next 10 years. I've been into endodontics for exactly 10 years of my life now, but it does not give me that adrenaline push anymore. I had my mentors for endodontics. Now I'm switching over my forte to more of aesthetic dentistry.
What's that about, aesthetics and restorative dentistry, and what attracts you towards it?
The reaction from the patients. Once you give them the smile that they were looking for,
it's instant gratification.
Its biggest concern that students have is, sir, will I have work? Will I make the money that I need? You have to give it time. It takes time for a clinic to develop and to settle. It takes time to develop your name. The best marketing is word to word, mouth to mouth. There are a lot more things in dentistry than just sitting in a clinic. The current Chief Justice of India has been my patient.
Wow.
I would say more than the focus, it is the maturity that comes in your thought process, which comes when you get into masters. We endodontists don't invest in gold. We invest in night-eye. They know I respect my work, I respect my time, I respect everything. Nobody even dares to bargain with me because you're not respecting your profession, so the patients are also not respecting your work and your profession.
Hi everyone, welcome back to a brand new episode of the MADtherapy Sessions podcast. Our guest for today is Dr. Anand Mohatta. He has completed his Masters in Conservative Dentistry and Endodontics from Govt Dental College Mumbai and his BDS from Rural Dental College Loni. Dr. Anand was the founder president of the Maharashtra Association of Conservative Dentists and Endodontists. Currently, he has his own specialized private practice in Mumbai and is the founder of many dental startups in the country. The audio podcast is available on Spotify and Anchor. The links to that in the description down below. Before we dive in, a huge shout out to Immersify Education for sponsoring today's podcast. Immersify Dental is the ultimate platform for dental students out there. It's a perfect resource for dental professionals looking to review weaker areas and busy educators who want to help their students excel. They have a wide range of free resources, but I'm personally using their premium version for quite some time now, and they have successfully managed to incorporate augmented reality, interactive animation and gamification with dental learning and make it the most feature-rich dental app out there. And as listeners of this podcast, you will receive a 10% off on your monthly subscription to Immersify Premium. The link to that is in the description down below. Do check them out. Drop a like if you like this video and consider subscribing if you end up loving it. And also don't forget to comment down below your thoughts on the podcast. Till then, enjoy the episode. So Dr. Anand, what is the role of a mentor in a dental student's life?
So I would say a mentor is very, very important. It's something that is there as a guiding light for you. Mm-hmm. How and why do you need a mentor? Because there are a lot of distractions. There are a lot of different things being practiced or different methods of doing something.
Right.
And it is very difficult to know how exactly you're supposed to do it. How do you learn it? How do you practice it? Where do you learn it? Who's the right person to guide you? You need that guidance, which is possible only from a mentor who has been there and done that. So getting a mentor who shows you that light is going to be very important. In fact, as I was talking to you a few minutes ago, I'm kind of at the cusp of changing my forte or my love for the next 10 years. I've been into endodontics. I finished my master's in 2012 now. So I've been into endodontics for exactly 10 years of my life now. And now I'm kind of done with endodontics. Not done with endodontics in the sense that I'm not going to practice endodontics. Obviously, I'm going to practice it till I die.
Yeah.
But it does not give me that adrenaline push anymore. Maybe because there is nothing new or nothing path-breaking which is coming down in endodontics anymore.
Right.
Everything and anything that had to be done is literally done. We have achieved most of it as far as I can see. So now I had my mentors for endodontics. Now I'm switching over my forte to more of aesthetic dentistry.
Okay.
And just 2 days back, I spoke to a person, if I can name him, Dr. Mohan Bhuvneshwaram from Chennai. And he's going to be my new mentor, my first mentor in this path for aesthetic dentistry. And I'm looking up to this journey.
So how did you decide to switch to aesthetic dentistry from endodontics? What were your reasons? Like, for example, you said you had a mentor and then he shifted his focus, like your focus to aesthetics. How did he help? And
so the mentor didn't help shift my focus. The mentor is pretty much still into endodontics.
Okay.
It's just that I thought that I need to start doing something else. You get bored of doing that same procedure or the same thing over and over again. At some point in your life, you will be like, boss, I need a change. I need to switch over to something else.
Right.
So the whole point was maybe because I'm kind of a personality who does not like to do that same thing.
You get bored.
I get bored. I get bored a bit too fast. So maybe that was the whole thing, that I didn't get that adrenaline rush which you get while doing something. So when I'm doing composites, I'm in my zone in the clinic. I'm enjoying it. I'm literally singing. I'm whistling. I'm in my zone. That time I literally don't care what's happening around. So I love to be in that zone.
So what's that about, aesthetics and restorative dentistry, and what attracts you towards it?
The reaction from the patients. Once you give them the smile that they were looking for, and the reaction from the family, the phone call that you get in the evening.
Right.
My wife loved it. My parents loved it. That's all.
It's instant gratification.
It's instant gratification, immediate gratification that you get with it. Endodontics also gives you that gratification because you give pain relief to the patient. But that confidence that a patient gets after that smile changeover is a different level of high, because you change the person's personality to some extent.
Right. You have been a mentor for we spoke about your mentor, but you also have been a mentor for a lot of students, including me, at various points in our career. When people look up to you, what is the one common thing they come and ask you and about dentistry, what to do, what not to do, or how do you help them?
So to be very, very frank, sadly, dentistry seems to be going through a very tough phase right now. There are a lot of dental clinics all around. I don't think so there is any corner of India which does not have a lot of dental clinics. There is competition everywhere. You go on any corner of India, any village, city, any place, 2-tier, 3-tier metro, you go anywhere, there are a lot of clinics there.
Right.
Everyone knows this.
Right.
So the biggest concern that students have is, sir, will I have work? Will I make the money that I need to survive? And my suggestion to them is, you have to be patient. You have to give them the time. You have to give it time. It takes time for a clinic to develop and to settle. It takes time to develop your name, because in a medical field, the best marketing is word to word, mouth to mouth. Nothing else is going to help you.
No amount of any marketing will help.
I really don't feel putting pamphlets and sending SMSs or doing free dental checkups is going to give you the quality of patients that you're looking for.
Right.
A free dental checkup patient would probably not be the right patient for you to treat, because they would not agree to your charges as well, right? So I feel it's mouth-to-mouth marketing, which takes quite some time to develop. That's the only disadvantage. But the biggest advantage is that patient is already converted for you when he sits on that chair. You don't have to convert the patient. You don't have to make the patient agree to your treatment. That treatment plan is by default accepted by the patient. You don't have to break your brains and, go beyond anything normal to explain it to the patient, because the patient comes with that comfort and with that confidence in you. So that is what you need to work on. You need to give time, and see, there is competition in everything. Every profession on earth has competition. Even begging has competition on this earth. You go to a signal, you will see 10 beggars around. Right. But you will pay only one, if at all, if you pay, right? They also do something different. That's why you end up paying only one, right? It's as simple as that. It's a very blunt example, but it gets across the point, right? So I say competition is going to be everywhere on any profession that you look at. Just give it that time. And obviously, under dentistry, there are a lot of different things that you can do. Do that. Don't waste your time just sitting in the clinic and wishing there are no patients and hating yourself that there are no patients. There are a lot of things to do in dentistry. Start doing that.
What you mean is pick a niche,
like for example, that you have picked up a niche. Pick up a niche, pick up something that you like, pick up something that you enjoy doing. Just yesterday, I was speaking to an endodontist from Bangalore. She was like, sirs, I have only 2 clinics. I'm sitting around the whole day. And then after this whole conversation where she was bitching about the whole world, she tells me, by the way, I'm also an artist and I do calligraphy. And I was like, dude, why are you here? Why are you bitching about the earth? You are an artist, you do calligraphy. Convert that into something. See, your 9 to 5 is dentistry, okay, but your 5 to 9 can be something else. And then work so hard on your 5 to 9 that it becomes, and it funds your 9 to 5, and you don't need that 9 to 5 anymore, maybe. You do dentistry. I'm not saying come out of dentistry, but do it for passion. Don't do it for making money. Do it for passion. Do it for fun. Do it for a change. But create your niche. Use your passions, what you love, what you enjoy doing, and then develop into it. And you can always mix it with dentistry. For example, I told her, give me a logo. I want to design a logo for my new venture. You're the best person for it because you know dentistry and you are into designing. Develop that. You can do a lot of things wherein you combine both the things.
True, absolutely.
You have to combine your passion with your profession so that you get the perfect mixture. That's something that is a difficult nut to crack, but you need to crack it.
Because a lot of people complain about, including me at some point, saturation, dentistry saturation. I'm hearing this since I entered dentistry in 2009. And it's almost 14 years now and people are still, like you said, it's going to be everywhere.
And it's going to get worse. Yeah. It's not going to get better. So don't expect it to get better. It's surely just going to get worse, right? So there's no point bitching about it because you can't do anything about it. So do something that you can do. I'm always a believer of doing things and changing things that are in your control. There are many things which are not in your control. So you can spend 5 minutes thinking about it, but giving more than 5 minutes makes no sense for things which are not in your control, right? So just leave it and work on things that you can change. And trust me, you can make a drastic change on it.
So it's like, becoming a dentist or doing dentistry, a viable career option in 2023, according to you?
If you're thinking of getting admission into dentistry in 2023,
yes,
I would say look at different options also. Why so? Because life is going to get tougher and tougher for dentists in India for sure, and maybe globally. It's not that easy anymore, or globally the options for dentists is not that wide anymore. It is going to be a tough nut to crack. There are many other career options which are becoming which are becoming an option right now, or which have just suddenly come into the market in the past 10 years maybe, since the advent of social media and the internet going everywhere, which are maybe good options for those people. If you're already into dentistry or you're already taken the plunge, there's no going back, right? So then you have to make sure you do everything. It's like Sam, Dam, Dan, Bhed. You have to give in your everything and make sure you do good at it. It comes down to your passion. It comes down to, it's not just about money. It's about you feeling good about what you're doing. You enjoying what you're doing. That process should be fun, not just the destination. And you should enjoy that whole process.
And there will be a lot of trial and error method. Like you'll have to keep trying new things, keep reinventing. You can't land at the correct spot. Like you said, you must have done a lot of different ventures in dentistry, and finally you'll come down to something which you love, and now okay, for you, at least for the next 10 years,
this is what it is.
Exactly.
So that happens, right? Obviously, you will have lots of hits and misses. You might think something is going to do good in the market, for example, or something that will give you a high, but it does not turn out that way. Or you might partner up with someone as a partner and it might not turn out that way. You will always have hits and misses, that's the whole point of trying, right? If you don't try, you don't know what's the hit and the miss, right?
Exactly. You have to keep shooting.
Some point you're going to hit on the bullseye. Right. But if you don't shoot, you're never going to hit the bullseye. So the problem is with people is that they don't shoot. They're scared of shooting. If you're scared of shooting, we'll never hit the target. Right. You can miss, right? That's okay. That's acceptable. But give it a shot. So keep on doing it. Keep on looking at good ventures, different things that you can do. There are a lot of things in dentistry to do. Not just sitting in a clinic. There are a lot more things in dentistry than just sitting in a clinic. So think of those ventures, think on those verticals, and you can get something better.
Right. In your short career till now, you have taught hundreds of students. And so according to you, what's the main difference between students back then when you started and today?
So it's been just short 10 years. I am not that old, so I have not seen a generation change in students. So I have not seen a drastic generation change in students. But yeah, I can say that era in which we studied, there was no social media. There was not a lot of exposure to the outside world dentistry or the dentistry which has been practiced itself just outside my college. When we are in the college, the only dentistry we know is what is happening in the college or what is happening in my clinic, for example, or to a few clinics nearby. So because of social media, suddenly everyone is exposed to a lot of great dentistry also. So what is happening is a lot of students are now passionate about doing great work once they are getting to see it, which was not, we thought it was not possible. To put it very frankly, when we used to see those cases in articles, we never thought it was possible.
Right.
It could not be done. Now, when we actually see the process of it being done in videos or social media posts or whatever,
right.
Now some things That is what I'm seeing in the students, that now they are working hard for it. There's a group of students who don't care, which is always there. But then there is a very good group of students who are passionate about giving that service, which is a drastic change which I'm seeing because of the exposure they are getting through internet and social media.
Like it's possible to replicate the...
Yes, and many people are achieving those global standards now in India as well.
And in fact, making it better.
Yes. India is not behind anymore. So
my next question was, a lot of students do a lot of mistakes. So what are the common mistakes you have seen students do, which can be avoided?
In dentistry or in
dentistry?
They jump to treating a patient. That's the biggest mistake I have seen, not just by students, I have seen it by young clinicians, decently old practice clinicians. They jump to doing treatments. Never show to a patient or never let the patient feel that you want that patient or you want to immediately start the treatment. That gives very negative vibes to the patient. I would always say, give it the time, let the patient think over it. Don't jump to a treatment or a treatment plan until first you are clear about it and the patient is clear about it. Don't jump to a treatment, because I have seen a lot of issues arising because of that, because the patient was, not taken in confidence completely before the start of the treatment. Don't do that. That's the biggest factor. Because right now, not just doing the treatment, the way you do it and the way the patient feels about the treatment is equally important. So you need to give a lot of focus on that, because with so many clinics around, one negative thing that happens is a lot of back bitching also happens about dentists around. So your neighborhood dentist might not talk good about you to a patient, right? Even if you have done a decently good work, your neighboring dentist might not talk good about you. So you have to not let that thing come in between you and your practice.
What would your advice be for students who are into dentistry now? I mean, they're doing BDS or into MDS, and what would your advice be for them?
If clinical dentistry is what gives you the high that you want, or is what is paying your bills, do that, concentrate on that. There are a lot of things to learn. You don't need to do masters by default. I have seen amazing clinicians, amazing people who are doing endodontics better than people who have done masters in endodontics. I've seen BDS people doing great work in every field, not just in endodontics, for example, in every field who are doing great work with just a BDS degree. The degree doesn't matter. It is how you work and how you develop your degree and how you gain knowledge. Gyan sab jagah bat raha hai. It's like what Amir Khan said in 3 Idiots, right? ज्ञान मिल रहा है, सिर्फ बटोरने की जरूरत है.
बराबर.
You have to just go and get that knowledge and apply it. And you don't need to invest a lot to do decently good dentistry. It does not mean you need a scanner, you need a printer, and you need blah blah blah. You can do decently good dentistry with literally not spending much more on your practice, right? You don't need a microscope always. You can do most of the things with a pair of loupes as well, which is not that costly. That's a good start. I'm not saying you don't need a microscope, but that's a good start. So
you don't need to jump directly to a microscope.
Yes.
You can go step by step.
Go step by step. Whatever your pocket is allowing you, do that. If your pocket is not allowing a microscope, that does not mean you don't even buy a set of loupes. You at least buy a set of loupes, because that is going to change your dentistry by a great margin. And not just that. One more thing that I like about loupes or a microscope is the patient also realizes it. That something different is there.
Right.
And see, that makes an impact on the patient. This is what I always tell my students when I'm teaching rubber dam as well. So I take classes for rubber dams, and when I'm telling the students, I always say that, see, 99% of your patients who are going to come to your clinic wouldn't have not experienced a rubber dam. And when you explain to them why you're using it, how you're using it, what difference is it going to make, the patients understand it, they value it, and they appreciate that you're putting in the extra efforts to give them better service. That is what they are looking for, right?
Right.
Everyone is looking for better service. They are okay to pay more. See, the higher cost is going to pinch them maybe 1 day, 2 days, 3 days, but the quality is going to be with them for life. So make sure you're giving them that good quality and not just thinking about the price.
And like you said, it automatically distinguishes you from the other dentists when you're using a loop or a rubber dam.
Exactly.
And when you're using a loop, I mean, I started using loops, I think first with you only, and you get a different perspective towards dentistry. It changes your, it broadens your horizon, and the way you look at treatment, everything changes as a clinician also.
Everything changes. Your treatments improve. To put it in simple words, your treatments improve, because you see better, you do better. Right? It's as simple as that. You see better, you do better, and that's gonna give you better success rates. So that's the whole point. Even for example, photography. You take a picture, put it up on a screen or take it up on your phone, show it to the patient. You just telling them ki idhar khadda hai, idhar filling karna hai. They're going to go by your word, right? And if you say udhar do daanton mein khadda hai, they're going to go by your word. They don't understand ki ek mein hai ki do mein hai. The patient is, even when we are the patients, we don't understand it, right? So take a photograph. It's not a big deal. Now everyone has a decently good phone where you can take a photograph. I'm not talking about a DSLR photography as well. Take it, show it to the patients, because most of the doctors are not doing that. Take an intraoral camera for that matter. Use that. Show it to the patients. When they see it, they will trust you. And that is the most important factor right now, that people are not trusting the new dentists who are coming out. And it's not wrong on their part. There are a lot of dentists who are sadly cheating the patients, doing things and not actually doing things, and doing a lot of grossly wrong things. So patients are not wrong on their part. We just have to overcorrect ourselves.
And I always believe that because when you use an intraoral camera to show patients, it's their teeth. They are supposed to know what's going on, and it's a great practice builder too. Like for example, if they come for one filling, and if you just show them. I mean,
all the black thing all around, and they're like, "Bhai, ye bhi bhar de."
Exactly, they're not gonna say no to you.
Obviously, because they can see it.
Right.
They can obviously see it. So, if not now, maybe within 2 months they'll come down back to you.
True. So
that's what you want, right? You want more work.
Yeah.
Create more work for you.
That's how you keep improving, like little by little as a clinician.
Yes.
Have a lot of teachers who have taught you, and you have been a teacher for a lot of students. So, what motivates you as a teacher on a daily basis?
So I am passionate about teaching. I just enjoy teaching. I just love teaching. I like to see that smile on a student's face when he actually understands the concepts. Also, I usually teach for students who have already done dentistry. Who have already learned their stuff in dentistry, and now they are either trying to get into MDS, the entrance exams, or teaching them clinical dentistry. So they have already gone through a lot of teachers talking about those topics that I'm talking about and not understood them. So when, for example, for a topic like bonding, which is something which is literally not understood so well or not taught so well, sadly, in colleges. Once you get down to the dead basics of it and explain the whole science behind it, and that smile that comes onto a student's face after understanding the whole concept and realizing that it was so simple. Why was it so complicated for me earlier? That gives me the satisfaction that I desire, and that makes me feel good. And I love teaching. It's just that I love teaching. Whenever I get a chance, I feel I should start teaching again. It's just that I don't get time anymore.
How was the transition? Because of the pandemic, not a lot of people were doing, say, like digital class. They were doing it the traditional way. But due to the pandemic, we were forced to teach digitally. So how was the transition for you as a teacher? Going from traditional classes to giving lectures digitally, at least for that time.
So I am more of a traditional teacher. I am not more of the pandemic teacher, as you might call it, because I like to see that feedback. That is what I was talking about. For me to see that feedback is very difficult if I'm talking to a camera, right? So for me, I didn't enjoy much. I did host a lot of sessions during the pandemic, but I was not so involved as a teacher.
You didn't enjoy it.
I don't enjoy it because I need to see that feedback. And for me, I work entirely on that feedback. If I need to emphasize something 10 times, I'll do that. But I need that feedback coming back from the student, which was not so easy during the pandemic or for the online teaching methods. So I'm not that fond of that. I'm more of a personal touch. And most of the times I don't even use presentations. So I'm more of a, chalk and blackboard kind of a teacher, or a paper and a pen kind of a teacher. I don't use presentations. I many a times don't use anything. I just take a paper and pen and start explaining. So I work more on those traditional, super old conventional concepts and methods. But that works for me and that works for the students. The feedback I've always got from my students is, so you don't take a presentation. Just teach us the way in the flow. That is how we grasp more, and it keeps it more, what can I say, open-ended. They can easily ask me questions, clear their doubts, and it creates, a comfort level which is different as compared to a presentation kind of thing. Because in presentations, I don't know, it forces you to go by it. And I don't like to do it, especially in my teaching. I don't want to be forced by something.
I mean, speaking about the pandemic, how did it affect you personally? and as a clinician?
Personally, health-wise, it made, I guess, everyone serious about their health. It made everyone serious about respecting their family and their loved ones. There were times when we literally didn't care about our family or our mom or our dad or our support system, as you might call it.
True.
And we realized that if they are not there, we will find it very, very tough to even survive, say the least. We always used to think, "Arey, mummy kya karti hai din bhar ghar pe?" But then when you realized and when you spend those 24 hours the whole day in the home, you realize कि मम्मी दिन भर अपने से ज़्यादा काम करती है.
बराबर.
And you started getting that different respect for your family, for your sister, for your brother, for everyone because of the pandemic. So pandemic did a lot of wrong, but it did a lot of right also, especially in our heads. It made us realize a lot of things that were not being respected, and it made us respect those things. One, as a clinician, it made patients serious about dentistry. It made clinicians serious about dentistry and their safety. There were many things that were overlooked by us. To give you an example, I have never worn a face shield in my life ever. In my past 10 years of clinical dentistry that I would have been practicing. And the day COVID struck and suddenly we had to wear God knows what astronaut suits and stuff. And I started using that face shield and I started realizing, oh my God, this is the amount of splatter that was coming on my face. Forget anything else, it's on my face. We got serious about the safety measures. A lot of things got improved, which maybe the developed world was already doing. We as Indians were not doing it, cutting corners maybe at some places.
It pushed us
and it has made us do it. And it is supposed to stay now. The whole point is, don't go back to our old ways of doing it. And yes, it cut down my clinic hours. So that's one good thing that the pandemic did. That it cut down my clinic hours. It stopped me from traveling so much now. So I don't travel so much anymore. So it has got me in a bit more relaxed life in terms of physical travel and stuff. And a bit more free time as well.
Mentally, when you are forced to shut down our practices for a few days or weeks or months, depending where you stayed, how did that affect you? Did that affect you as a clinician? Or,
I don't think so. It affected me much. I started back my practice within 2 months.
Okay.
So I had to start back my practice within 2 months. Exactly after 2 months, in mid-May, I started my practice. So the first patient I treated, I felt God knows what I'm doing. I didn't understand what I was doing. It was a root canal and I don't know what I did. It was after 2 months, it was suddenly wearing all of those things, doing a practice was a difficult thing. But after that, once you get into the zone of it, I don't think so. It didn't affect me much. In fact, those 2 months of lockdown were the busiest months of my life. I had to take a cup of coffee in the afternoon and stay awake because me on World Dental Association were hosting a lot of webinars and educational series for dentists all around the globe. So we were actually hosting at least 2 or 3 webinars a day and it was a taxing time for us. So in fact, I had to stay away and work hard in getting things streamlined. So I didn't have a chill time. I was either hosting webinars or I was attending webinars. I was either educating myself or educating the world, but I was not free.
One more question I had for you was, how do you keep upgrading yourself as a clinician and how has your practice evolved as a clinic? Especially your endo practice in this last 10 years.
So upgrading yourself is very, very important. If you're not upgrading, you are falling behind everyone. You have to understand that every 10 years, the whole forte of dentistry will change. If you look back 10 years, 15 years back, nobody had an RVG in their clinic. Now, literally every other clinic has an RVG. Every clinic in India, for example, has an RVG. And that is exactly going to be the scene for scanners. 10 years down the line, 15 years down the line, every clinic in India is going to come down with a scanner. If you are not upgrading, you're falling behind. At the end, it's a race and you have to run it. You like it or not, you have to run it. So upgradation is very, very important. Patients look up to it. Patients appreciate it. Patients understand it. And the new generation of patients who come down, the social media generation of patients who are visiting us, they appreciate it and they understand it. There was a group of patients which is in their 60s and 70s, which are okay with the old ways of doing it. But they are not your patients for long, right? The new patients, the younger patients are going to be your patients for a long time. So you need to upgrade. If you're not upgrading, you're falling behind. How my practice has been upgraded. So I started my practice with a microscope. So I made sure that I am already into
one step forward,
a step forward when I'm opening my clinic. So I made sure I worked hard during my consultations and collected that much amount of money that I can open with a microscope. But see, buying a microscope is not the end of it. With a microscope, you have to buy 10 other things, which slowly I understood once I bought the microscope. Okay, I need this also, I need this also, I need this also. And slowly you go on upgrading them. So in a clinic, you also need a good scaler when you're working under a microscope. You can't work with a simple scaler that comes with your chair.
Right.
You need a good quality scaler. You need a good quality light. You need good mirrors. You need good instruments, fine instruments, lot of stuff, a hell lot of, and you need good assistants. That's the most important. You need a good team. So, that is how the upgradation happens. It happens step by step. It happens slowly. You have to give it that time and you have to be open to it. You should never think that you're done upgrading. There is never an end to it. I always have a list of at least 7 to 10 equipments that I want to buy in my clinic. Most of the people I meet or my colleagues would say, dude, you already have everything. What do you want to buy more? But there is always a scope to improve. Right. If you're doing shade matching with your DSLR photography, you always have a Vita machine which will give you the exact shade.
Right.
So there is no end to it.
Do you have that? Or do you plan to buy it?
It's in my list. There are a lot of things in my list. So I said, I have 8 to 10. It's on my phone always. It's there on my table. That list is written on my table and I keep on ticking it. One is done, one is done, one is done. So scanner was in my list. I just got a scanner about 5-6 months back. Now the next thing would be a laser. The next thing would be something else. But it's always in the list. You should never stop upgrading. If you're upgrading, you're falling behind. I always used to give an example. It is like keeping your money in cash. Inflation is always going to happen, right? You can't stop inflation. So after 5 years, that 1 lakh rupees which you have in cash is worth maybe 75,000 rupees. That's exactly how if you're not upgrading, it happens. After 5 years, you're not what you were 5 years back. You are behind yourself now. True. So you have to think in that way and you have to upgrade.
But it has to come from inside, because I have met a lot of dentists, like you said, according to them, they're done. They don't want to upgrade. Why? The patient won't pay more. When I talk to them, I say, it's not for the patient, it's for you. It's
You don't buy a microscope for the patient. You don't buy a loop for the patient. You buy it for your back. You buy it for your neck. And the good dentistry is an advantage. You're not buying a microscope for doing good endodontics. It might sound very counterproductive or what nonsense is this guy talking, but that is how it is. Because the change that microscope does to your back and your neck is what is important for you, right? Your back is going to stay with you for your life. Yeah. Give it that love, give it that care, and that microscope will do that. Loops will do that for your back, right?
Right.
So patient is never going to pay more. No patient is going to come and tell you, sir, आप वो microscope use करो, मैं आपको ज़्यादा पैसा दूंगा. No patient is going to come and tell you that, right? I listen to a lot of people. Why are you using this brand of composite and not this brand of composite? Sir, वो patient को थोड़ा ना patient नहीं देता है पैसा. अरे patient does not understand it. You need to understand that the patient does not know. When you start using a rubber dam, patient will understand that you are doing something different. And 6 months down the line, you can increase your charges. For the first 6 months, you will be learning. After 6 months, that L will vanish and you will start earning. But you have to give that 6 months for your patients also to understand, and you will also take some time, right? It's a learning curve. You're not you did a course or you saw some online course or you saw a lot of people doing online good rubber dam placements and the next day you are doing amazing rubber dams. It takes you also 6 months to do it. Give it that time and then patients will start paying you.
I always think about it, and that is the reason why personally I buy the best bonding agents and the best composite is not for the patient. Of course, that's a byproduct.
Yes.
The patient gets a good product, but it's for our mental peace also that we have given that feeling will stay. The patient will feel happy, can eat, drink, everything, and
do whatever you want.
Exactly. So you don't go to bed thinking, I think this.
You don't go to sleep thinking about it.
Exactly. So it's for you.
It's totally for you. So when I get patients and I tell them it's a class 2 filling, I need at least 1 hour, 1.5 hour for doing your filling. And he's like, why so much? The other guy did it in 10 minutes. I was like, you'll understand the difference. I don't tell them anything else. I'll tell them just, you'll understand the difference. Don't worry. And within the first 10 minutes of it, they know what is the difference.
True.
Because they see the rubber dam, all the equipments that I have kept ready for them and all the steps that I go through, they understand that this was way different than what they had undergone before.
Right.
And once you're done with the treatment, because you're so confident about your materials, your techniques, your procedures, there are no restrictions to the patients. I have heard a lot of dentists saying, ye mat khana, ye mat khana, ye mat khana, ye mat khana. And I'm like, jo khane ka khao. We don't care, because I trust my procedure, I trust my dentistry.
Right.
It is not going to trouble you. You do whatever you want, just wait for a day, let the anesthesia wear off, simple, basic, and then do whatever you want. I don't care. I'm literally like that. I don't care. I tell that in front of the patient so that they understand that he's so confident about his work. Because otherwise, a patient gets a simple crown and they are told not to eat at least 10 things and they stop eating from that side.
They hand a list of all the
don'ts. There is no do's, there are only don'ts there.
Right.
And then the patient, I'm thinking he underwent that treatment to be able to do things.
True.
Not to be not able to do things, right?
True.
The whole logic of undergoing treatment was to be able to do things that he was already not doing, right?
Right.
You're handing him a list of 10 things that not to do. What is the point in undergoing that treatment, right? The patient starts eating from the other side. 10 years later, his TMJ is screwed. What's the whole point?
So you also have a huge role in dental ED. I wanted to know more about that because in your social media profiles and a lot of you keep posting about them.
So as I was telling you about, just clinical dentistry is never going to give you the money or the satisfaction or the monetary compensation that you're looking for. It is difficult. Okay to accept it. There's no harm in it. People who are saying that they don't want money or they don't want that monetary compensation are maybe not telling you the truth. It is difficult to have an established practice when you join practice in the past 7 years of practice maybe. It is still difficult to establish a practice in Mumbai or in anywhere in India, I would say. You have to be either very lucky or very good in patient management to go to that level. I guess you are going through that same growth phase of a practice there.
True.
And I always wanted to do something different. I always wanted to interact with good people, learn good dentistry from good people. So somehow it so happened that, as I was telling you about, I'll just go through the story behind Dental ED and how I joined it. So we have a group called as World Dental Association on Facebook. It's a pretty old group, 2011. Abhishek from Jammu had started that group and I joined that group randomly. I had no interest in anything. But once I joined that group, I started becoming active in it. And I started doing activities there, hosting webinars, hosting sessions out of no interest, no monetary interest or anything else. Just doing it for the sake of doing it. I was like, these people are doing a good job. They are sharing education. Let me also do whatever I can. And then from there, I got a contact of some person from Style Italiano who was like, oh, could you just help me with something? I was like, I'll surely give you some reach. He was posting a survey. So I was like, let me post it on my group and it will give you a better reach.
Right.
And we did that. And then I started speaking to him. And these guys, we always used to think that these guys would be hard-headed and I don't know how they would have arrogant an ego or arrogant and God knows how they look as Indians and blah, blah, blah. And I just messaged him, would you like to come to India? He's like, I would love to come to India. I have been there once. And he was so cool to talk to and it just gave me that confidence. Okay, maybe I can do something in this. And he gave me the contact of Mr. Emmanuel, who is based out of Melbourne, who is the head of Dental ED.
Okay.
And Dental ED is a global dental education company since 2004. So they have been there since at least nearly 20 years now.
2 decades
they have presence in at least 20 countries. So from US to New Zealand, they are present literally every decently good country, they are there.
Yeah.
They were in India about 10 years, 15 years back, but they could never break it. And I started talking to him. We had telephonic discussions for at least 6 months. And finally, he had the confidence in me and I had the confidence in him. And we started and decided that we'll hold high-end niche courses in India, which are not happening in India. Courses which are of the top class quality with top quality speakers. We are not talking about speakers who are very basic or talking about very basic dentistry. We are talking about the best in the world. And I thought that's a good market in India to work on. That would give me 2 things, some monetary compensation as well. It would give me a reason to come out of my clinic. That was one very important thing that I wanted.
Right.
Because after a point, you are just stuck in that small room with your 2-3 assistants doing those same patients. And you don't have a social life. You don't have anything else to do.
And sadly, most of the dentists
are doing that. you need to come out of this. You need to come out of that operator stool of yours and that dental chair of yours. Even if it is just for dentistry reasons, it gave me a chance to come out. It gave me a chance to develop a whole team. So I have a good team of at least 10 dentists who work with me in dental ED. And trust me, we enjoy it like anything. We sleep 2 hours a night when we are hosting a course like that. But we enjoy it. We sleep on the floor, we sleep anywhere, but it is so much great fun to do it. And obviously we get to learn.
Right.
That's the biggest byproduct out of it. You get to learn from the best in the world. What more can you ask for?
So any dental ED lectures or conferences happening this year or anytime
We are
soon?
working on it. So COVID fucked us, to be very frank. We had 3 courses lined up in 2020. COVID happened. Everything got disturbed. We have been working on getting it back on track. Most probably I'll have something coming up in June.
Okay.
I'll have a big shot in composites coming down to India and taking a course. A guy who has never been to India, but he has written kind of the Bibles of composites, if I can say that. The book that he has written are the Bibles of composites. So we are getting someone big.
Wow. So we'll wait for that announcement. We won't ask you right now.
Yeah, I won't tell you also.
So you also have been a part of many startups like BuzzDent
Yes.
and Atyanta. So can you share something about that?
I always love to do different things, as what I was telling you. Dentistry is just a part of it. So one fine day I was speaking to a school friend of mine.
Okay.
He was already into dental manufacturing. He used to manufacture stuff, plastic stuff that we use in our clinic. And he was like, yeah, I want to do something more. And I was like, yeah, I want to get out of my clinic. I also want to do something more.
Right.
And we just decided to have a partnership and started a firm by the name Atyanta. So Atyanta is a Sanskrit word which means perfect.
Okay.
And here what we decided is we will have all made in India products. Everything would be totally made in India. We'll give good quality. We'll make sure we don't compromise on the quality. And we'll try to develop our own market for good Indian products. People who respect quality at economical rates. So
Right.
I'm trying to give the quality which an MNC would give you at some maybe $5,000. I'm trying to give you that at $2,000.
Okay.
So that was the whole thought process behind it. And this has been 5 years down the line. And we have been working hard on it, and we have expanded our portfolio to many things now. And it is being doing good. It keeps me busy. It keeps me, I'm looking at things at a different way now. Once you get into the manufacturing part of it, you realize a lot of thought process goes into it. And you enjoy that process because you understand the research and development that goes through developing a single product. To just give you an example, we were developing a temporary restorative material, something that you use post endodontics or just pack in inside the mouth. I had to create 150 prototypes.
Wow, that's crazy.
And I rejected them all. So you can imagine. It takes a lot of hard work, but it is fun. We ended up rejecting them all. So you can understand that we have to put in that much effort to get the quality that we are working on. But it gives you a high. When people love your products, people come back with your feedbacks that they're enjoying it. It is a good thing to know.
So how was the whole experience? How difficult or easy was it to do the made in India thing?
It is very difficult. It is very difficult to tell you something. Even a mouth mirror is not made in India. The very, very cheap quality mouth mirrors are made in India. The decently good mouth mirrors that you would be using in your clinic are not made in India.
Right.
And we might not give that much of a thought process to it. A simple mirror head requires at least 10-15 steps to go through with different people and different things to get manufactured. And it is very tough. It takes a lot of time. It takes a lot of energy. It drains you out at times and you are like, I don't want to do it anymore. But it gives you a different fun when you develop a product and it does good in the market. It is difficult because it's something which not many people are doing. You don't have someone to guide you or mentor you. You don't know the path. You have to find the path on your own, which is difficult. You have to search for things to get done.
Right.
But you get your way. If you're adamant at it, you will get your way. You have to stick to it.
So bioceramic sealers are the current rage in India, say. What's your take on it?
So one of the best products that we have at Atyanta is a bioceramic sealer.
Okay.
We launched our bioceramic sealer about 6-8 months back maybe. I've been testing it for the past 1.5 years now. And bioceramic sealers have drastically changed our dentistry. They have changed our obturation methods, they have changed our post-operative instructions and post-operative comfort levels of the patients, and they have improved the success rates of our endodontics. It makes dentistry or endodontics easier to say it. It is for the lazier endodontist like me. For genuine endodontists who do it the right way would be going through that obturation process with thermoplasticized and everything. For a lazier endodontist like me, it's just inject, fill and forget. It is very biocompatible, so good to the tissues, your patients don't complain of pain. And we have a lot of MNCs which are selling bioceramic products, sealers for the price range of 4,500 to 5,000 for a syringe of 2 grams, which is bomb expensive. A routine dental clinic in India cannot afford it. That goes without saying.
Right.
Even the good practices cannot afford it. Forget a routine dental clinic affording it. So I had decided that I want to develop a bioceramic sealer and worked on it, gave it a lot of effort. And now we have a very good bioceramic sealer.
So you have
we have manufactured it. Yes.
Okay.
We have manufactured it. Works exactly like any of the MNC counterparts. 1/3 of the rate. So it takes a lot of time, takes a lot of effort, but it's fun. You enjoy it.
But the whole current range, is it worth it? Do you think?
Yes, it is worth it. I don't use any other sealer anymore.
Okay. That says a lot.
I still have packed sealers which I have not opened. So we end up buying in bulk, right? We don't buy one packet and then wait for that one pack to get over. So I still have some 8 packets of sealers which I used to use earlier, which are still there packed with me. And I don't know what to do with them. Because now for any and every case, I'm using a bioceramic sealer. There is not a specific indication that this case you are supposed to use that, this case you are supposed to use that. You can use any sealer anywhere for that matter. And bioceramic sealers are good to use in any way. And they do work. They do give you the biological seal that you want. The most important thing about a sealer is getting that seal, right? They give you that seal. Great. That's all that you're looking for.
Yeah.
Everything else is beating around the bush.
Right.
They don't stain the tooth. That's a good advantage. They're easy to remove also. With the Gatapacha core inside, they can remove it. There's no problem. So it does the job.
Right. I just wanted to know the expert himself.
It does the job.
Right.
You can start using a bioceramic sealer.
Okay. We go back to your early days when you became a dental student. You always wanted to become a dentist, or it happened by chance or something like that?
Never wanted to be a dentist.
Okay.
Though my elder sister was doing dentistry at that time, but I was the more intelligent student in the house. So everyone thought I would be a medico. I would get into medicine, but it somehow so happened that I don't know what happened during those entrance exams, and I goofed up so crazy that I didn't get the rank that everyone was expecting me to get. The classes that I used to go to, they were expecting that my photo will come on the newspapers. They were expecting something really great out of me, but somehow I goofed up on those exams. I maybe could not take the stress, and I ended up not getting that great rank. Even with that rank, maybe I would have got into a good medical college, but somehow fate had something else in mind, and some sting operations and blah 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 what happened, and I ended up getting dentistry into a private college.
Okay.
So that's okay. But the moment I entered into dentistry in a private college, my first thought process was, dude, I'm doing something which I didn't want, but now I have to make sure I excel in it. So my aim right from the first day of BDS was to get into MDS into a government college. That was the aim that I went with.
First day itself.
Yes. So that was something that I had decided right on the day I entered that college, that dude, okay, this is not something that you wanted. So now make the best out of it. If life gives you a lemon, make a lemonade, right? So the first day of my college, I decided I'm not going to cut corners. I'm not going to, go to my seniors. What is important, tell me, I'll read only that and I'll pass the exams. Right. That is not what I was looking for. From the first day, from the first year itself, my studying was focused into getting into MDS. So I was not just studying a BD Chaurasia, for example. I was reading at least 3 other books for anatomy, which even the medicos were not reading, because I was preparing myself for my masters. So dentistry was never the first choice, but I don't regret it anymore. I'm having fun. I'm enjoying it. Sorry?
It was meant to be.
It was meant to be, maybe. Whatever, fate has it. You can't, there are many things which are not in your control. Right, so this was one of those things which was not in my control. I could have maybe opted for a private medical college, but money is a big issue, right? True. Finances has to be taken care of.
So how was the whole BDS experience apart from studying,
It was fun. It was fun. Dentistry back then was surely fun. And I studied in a Gaon. You can call it as a Gaon. It was a village, Pravra in Loni. There was nothing there. If we had to watch a movie, we had to sit on bakdas. It was 10 rupees a movie which was shown on a projector.
अच्छा, okay.
वो projector जो typical lectures में use होता है ना पुराने types का. We were shown a movie on that projector and it used to take us at least watching that movie twice to understand it because the sound quality was so bad, the video quality was so bad. It was all pirated stuff that we used to get to watch there. But dentistry was fun, learning was fun. You had a different kind of friendship with your batchmates because you were staying with them the whole day. In the college you are with them, in the hostel you are with them, during a lunch you are with them, during a dinner you are with them.
Those 6 years, 5-6 years were very...
It was fun. Yeah. Birthday celebrations were crazy. It was a different... We used to play cricket. So we had a different level of fun. Dentistry was fun. We had a lot of issues with the management as well. So we enjoyed our time. So to tell you something, I have been till the Supreme Court of India. We have attended a case in the Supreme Court of India.
Why?
So our college increased our fees.
Achha.
It was for the whole academic year.
Without informing you all?
They informed us, but it was illegal.
Okay.
So for medicos, for denticos, and for the physiotherapy guys. The medicos paid up, the physiotherapy guys paid up. We 50 denticos decided we are not going to pay. This is not going to work with us. And to be very frank, Rang De Basanti had just released that time and we were more inspired from that, to say the least. So we decided we are not going to pay them. It was in my third year BDS.
Don't tell me you were the leader.
I was the leader. I have to be the leader. So I was the class representative for 4 years. I was the topper all throughout. So by default, I was a leader in the group. So Rang De Basanti had a great influence on us कि हम कुछ तो करेंगे, करके रहेंगे. And we were of that thought process कि भाई हारेंगे चलेगा. But किया ना, we'll go with that कि at least hit, at least try.
Right.
Don't just give up. We were kicked out of our colleges for 2 months. We were given notices to vacate the hostels. I have been to the Aurangabad High Court so often that उधर का watchman से लेके उधर का मामा हमको पहचानता था.
बराबर.
The judges used to see us. We used to go in groups of 10, 15 white coat pen ke and we used to do all that nakras also. So the judges used to see us and they would be like, finish off all the cases, my students are waiting. And we went against the college. We won the case later. Wow. It took some 8 years for the case to settle down finally. But way back in 2015, I guess, we got the money back as well. So that was a good thing. And we had fun. That whole process of going to the courts, attending the sessions, and then, I don't know whether I should say this. We cheated in our prelims exams for the third year because obviously we didn't cheat. We didn't study. We didn't study. Tomorrow is my prelims and today I'm sitting in the high court. What am I going to study?
Right.
जनरल मेडिसिन का पेपर फोड़ा, जनरल सर्जरी का पेपर फोड़ा, ओरल पैथ का पेपर फोड़ा, कम्युनिटी तो सबने चीटिंग ही किया.
बराबर.
ने वैसे पास किया था. So third year we had that different kind of fun which...
But those memories will stay forever.
Forever, for life. We still remember going in those rickshaws and those sumos and ST buses and going there, attending the Supreme Court. So whenever I see Supreme Court on a television, I go back in my flashback in 2005, 2006 when we had gone there as students. We didn't know anything. What do you know? But it was fun.
Like it's all fun and jokes right now, but
it was serious matter then.
Exactly.
It was.
And
so
what?
What it came down to, our final year results were never revealed to us.
Okay.
The whole MUHS curriculum, the whole MUHS university results were declared. Our results were withheld for 2 months. Final year, when you give, for our time, we had 7 subjects. You give 7 theory exams, you give 7 practical exams. No matter how good you are, you would have screwed up in one exam pretty bad that you're sure that I can flunk. I was pretty decently good student, but I was pretty sure I can flunk in my ortho practicals because I had done it so bad. I was also not sure whether I'll pass. Everyone has that at least in one exam, if not more.
Right.
And we didn't know whether we had passed or failed. And everyone still stayed adamant, no, we are not going to pay up. We are going to wait. Let the courts take up the decision. Then the courts obviously could not take a decision, but they gave the order that at least give their results and start their procedure. So I got 2 months less to prepare for my entrance exams as well. It can have a very big impact on my entire professional life.
Right.
But we were so adamant about, मैं बोला ना, Rang De Basanti had a great influence on us. So
but
we were
like
just,
your family supported you.
Everyone's family supported us.
That's a
there
huge
were,
thing. Like,
yeah, there were no black moles around that people were paying up.
Exactly.
पीछे से अपने पास पैसा है, अपने को क्या करना kind of a category. There were people who supported us. Our family stood with us, and that's how we could get it. But it was fun. That's something that not many people would have experienced it, but it was a different level of fun that we had in our BDS days. So I'll tell you something. We were kicked out of college, but the teachers were so sympathetic to us that they used to hold lectures for us secretly in some corner in the college, in some small room. They used to teach us still because the teachers were passionate about teaching.
Right.
They knew that we had not done anything wrong.
Barabar.
We are just stuck with the management and we are going locked heads with them. So the teachers used to still teach us. That was so admirable, and I have a different kind of respect for those two teachers who taught us it, even at that times. Because if the management came to know, they would have sacked them.
Exactly, the jobs were
it was simple for the management, right? They're not some unique people whom they can't replace, right? So the teachers still taught us. That was a very, very big thing. That was something that I still look up to.
And it stays with you.
Yeah.
When people do it, then somewhere and then you will also do it for someone.
Exactly. Right? So even when I go close to one of those teachers, stays close to where my sister stays. So whenever I go to visit my sister, I make sure I go and visit him.
Wow.
I might not meet my batchmates who stay in the same city, but I still make sure I go to his clinic and visit him because I have a different kind of a respect for him, not for everyone else.
Amazing. I mean, I've never heard such a
It was fun.
So you finally got into MDS.
Yes.
And in Endo. So why Endo?
I wanted a peaceful life. So I was pretty sure I don't want to do ortho or prostho.
Okay.
I was very clear in my head that I don't like those two subjects. After that, I was okay doing anything. But yes, I also would not want to do a pedo because I don't love kids. I'm not so crazy about kids. You need to love them to do pedodontics. You can't just do pedo for the sake of doing it. You need to love kids to do it.
You need
a lot of patience. Exactly. And I am very low on patience. That is something that is very obvious for me. So Endo, I enjoyed doing Endo. And it is not so, what can I say, stressful, like a surgeon's job maybe. And okay, I'm into dentistry. I also want to enjoy my life now. I don't want to get into more stressful jobs in dentistry now.
Right.
So my thought process that time was, which was greatly inspired by my sister and my Jijaji, because they both were dentists and they were doing those things.
Okay.
So I took their guidance for sure. And they had a big influence in me deciding my field because they were practicing it. They were like, boss, do endo. You'll have a relaxed life and you will make good money. It won't be that you're not making good money and you will still also have a good relaxed life. You won't have to run around at any time on the night and you'll be fine. So that's the whole thing. I went through their advice and I'm pretty happy I did it. It was my Jijaji's advice and I took it blindly.
And how was the whole MDS? Because like you said, you always wanted that. You finally got it in a government college. I think the best in the country.
Yes, it was one of the best in the country.
How does it feel? Like looking back now.
So I'll tell you something. I did my master's again under Dr. Mansingh Pawar sir. He is pretty strict. He is very disciplined and he screws you right, left and center. So when I was thinking of taking admission there, I had options of getting admission through All India to other colleges as well. But I had decided in my head, see, these 3 years of my life are going to decide the future of my life. The next 30 years are going to decide on what I learn and what I get imbibed into in these 3 years. Because these are the only 3 years that I'm going to really work hard and learn things. After that, that level of passion goes down to some extent, right? When you're not forced to do something. Here, I would be forced to. So everyone told me, don't take that seat because you will be screwed. Like crazy, and I was like, boss, I want to do it. In fact, to tell you something, I had the third rank. Sorry?
I want to be screwed.
That's exactly how it was. You know, a day before the admissions, I called up the guy who had a rank higher than me. I was the third ranker, second ranker. I called him up and he was like, I was like, boss, tu kya karne wala hai? Mere ko bata de, because I need to decide whether I continue with my other college or should I just come to GDC Mumbai. And he was like, boss, मैं सांप के बिल में मैं हाथ नहीं डालूंगा. That was his answer to me. And I was like, okay, तो मैं डालता हूँ. And that's what I told him and I did it. It was amazing. Sir is strict. Sir was very disciplined. He taught me everything other than endodontics. He taught me how to live life. He taught me how to live life with all the stress and tension, how to get over it, how to manage people, going down from a sweeper to the High Court judge or a Supreme Court judge, how to manage everyone, how to take care of it. With his interactions, I got that confidence. I opened up. I'm a hardcore introvert. At least by birth, I'm a hardcore introvert. I used to be standing in a corner in a social function. I didn't even talk to people. When I got into MDS and I started interacting with people, and I realized, boss, in this profession, you can't be an introvert.
Right.
You need to be an extrovert because you need that patient in your pocket. And that is when he's gonna empty his pocket into your pocket, right? So you need to be an extrovert. And I started opening up myself. I got that confidence in talking, which came with my interactions with sir and with the patients that he gave me. And that changed me as a person and then as a dentist. I learned a lot of things about life during my masters, then about endodontics. I proudly say that I did my masters from one of the best colleges in the country, but I have learned more about endodontics from Facebook than in my masters. Because ज्ञान हर जगह बिट रहा है, तुमको लेना आना चाहिए.
बराबर.
It's not just necessary that you learn from your college. You might not learn anything from your college. But there are always a lot of good things to learn from people, and there are a lot of bad things to not learn from people.
Right.
You need to understand, you need to filter out.
Right.
There were a lot of bad qualities about everyone whom I met.
True.
And there were a lot of good qualities about everyone that I met. Just take the good qualities, learn them, imbibe them, and move ahead.
Right.
Go to the next person, right? You have to keep on doing that. You have to learn. Don't stop learning. Everyone has something to teach. Even a rickshawala can teach you something. For that matter, you need to be open to that.
Right.
Even an assistant can just say something which will literally shake you at times. Ki boss, yeah, why didn't I think about this?
Because they're looking from a different angle than you.
That's the whole point. They have a different perspective about life, about whatever it is, which you might not be thinking about. So always be open to, and that is what I learned in dentistry. And I was handling his VIP clinic in my masters. And in this VIP clinic, anyone from a minister to a secretary to a high court judge would come down for treatments.
Right.
In fact, the current Chief Justice of India has been my patient.
Wow.
So I have attended his son's wedding. We had very good relations. So when you treat people of that stature and that knowledge, you can't fool them. See, it's simple as that. Sometimes you say something to the patient which you also know is a lie. But you say that at times to get around something, right? You can't fool these guys. They know you within a split second. When you open their mouth, they know you, right? They have scanned you and they know whether you're lying or not. So once you start talking to these kind of people, the confidence that it gives you, now I'm not scared about treating anyone. मेरे हाथ नहीं कांपते. कोई भी होने दो. It doesn't matter to me. Because I have treated the guys who've been there, done that. So now I have that confidence which I got from Pawar sir and GDC Mumbai.
And that is why where they are. So basically MDS was like a life game changer for you. And
not many people from GDC Mumbai would say that, especially the endo department. If God gives me an opportunity, what 3 years of your life you would want to live again? I would blindly go back to my masters.
Wow.
Not many people. No, I'm sure not even a single person would say that. Forget many people. I'm sure not even a single person would say that. But I had fun. I used to slog like a donkey, to say the least. We used to be in the college at 8:30. I remember the college used to shut down at 4:30. Only twice in my life, I entered the hostel at 5:30. And even that time, that watchman was like, "Arey sir, aaj itna jaldi?" He was literally mocking me. "Arey sir, aaj itna jaldi?" That's only twice that happened, that I entered back the hostel 1 hour later. I didn't enter at 4:30. I entered at 5:30. I never left the college on time. We used to slog like a donkey, and I used to consult also. So being a Mumbaikar and being in the city of Mumbai and in VT station, you were in the center. So I used to consult also. So I used to slog my ass like anything. And I used to be back at times at right 1 o'clock, 2 o'clock, because I had to make money. So I was doing that, but it was pure fun.
There's a meme which is coming in my head, but I'll tell you at the end, not right now.
You should tell me right now.
So, last question on this point was, according to you, what was the main difference between when you were like a BDS student and when you were like an MDS student? According to you, what was the main difference?
The focus.
Okay.
The focus that you get and the maturity that you get. I would say more than the focus, it is the maturity that comes in your thought process. which comes when you get into masters. As a BDS clinician, we don't have that maturity. You need to have the focus to look at that single tooth also, and then have that focus to look at the bigger picture also. Usually what I have seen with the students especially is that they don't look at the bigger picture. Just to give you an example, I just had a patient coming down, a dentist's father, just 3 days back.
Okay.
He was undergoing some dentistry with someone, and there was a goof up and I had to correct it. So it was an upper canine. So my thought process was not just to correct the goof up. My thought process was, this patient is undergo a full mouth rehabilitation, and this canine is a very important strategic tooth in his mouth because canine guidance and everything. So I have to look at it that way. My whole focus should not be just to take care of that single tooth. This tooth is going to come under a lot of stress later because of canine guidance coming into picture. Look at it at the bigger picture. Don't just concentrate only on the tooth, which is something that you get taught in your masters.
Okay.
That you have to focus on the problem at hand, but look at the bigger picture, which comes with masters when you do it right.
Okay.
There are many people who just do masters for the sake of it with just that focus on one tooth. It's not gonna give you anything. It's just gonna give you an additional 3 alphabets, MDS. That's it. It's not gonna change your thought process. And one more thing that gave me that getting the bigger picture was something very unconventional. Watching the series House MD. If you have seen that.
Yes.
You see how unconventional they are in their diagnosis and how they look at the entire bigger picture.
Yeah.
You need to do that. It's not just for the medicos. We are also working in the mouth. We are working in the patient's body. So,
and the way they break it down and connect to every part
you have to connect those dots, and you have to break down the whole thing and then connect everything. So that's also something that really opened my thought process. And I suddenly remembered in my first year anatomy, in the dissection table, there was some anatomical variation in the patient, and we were amazed by it. And I asked my teacher, "Aisa bhi ho sakta hai?" She was like, "Kaisa bhi ho sakta hai?" And it still remains with me. Ki expect the unexpected.
Right.
Kuch bhi ho sakta hai.
Yeah.
I just exclaimed, "Arey wah, aisa bhi ho sakta hai." I was just innocent student back then who understand nothing. हमको लगता था जो textbook में वही मिलेगा उधर.
बराबर.
But कुछ भी मिलता है. So now that process and that statement is still in my head कि हाँ कैसे भी हो सकता है.
बराबर.
So that thing comes slowly.
Got it. So we move to our last section, which is the rapid fire section, where I ask you a question. And you have
I'm
to
stressed
answer.
about this.
No, it's it's very something you
Chilled out.
Yeah. Your favorite BDS posting
Oral surgery.
and why?
The teachers there were amazing. It's not just about oral surgery. The teachers there we had were amazing. I still call them as my godfathers. I just met one of my teachers about a month ago when I had gone to Pune, and the different kind of respect I have for them because they taught us in a way that still rings in my head. Even when now I am doing an extraction, I can hear them talk. It was so, a lot of, I feel one of the biggest reasons why you start loving a subject or hating a subject is because of who taught you. It depends on a lot on how it was put across to you. That is what I feel. Oral surgery was put to us in a very different way because of those teachers, and we loved it. But see, surgically, you might also say everyone wanted to be a medico and oral surgery is the only field that gives you some connection to that. Just to give you an example, perio, not like a crazy subject that people end up loving. We had an amazing professor that time there in my college. And when he used to take a lecture, it was just magical for us. He was also a blackboard and a chalk kind of a person, and maybe I'm inspired by him, and that is how I take my lectures.
Right.
His lecture would go extend by an hour and we would still be fine with it. And my first love when I got my results for my entrance exam was I want to do perio. Because I used to love that subject because of my teacher. The whole point was how that subject was put across. You might end up loving a community dentistry also. It all depends upon how it has been put across and taught.
Yeah.
So oral surgery was taught to us in a very good way, and that's why we enjoyed it. Okay. We were screwed. We were thrown out. My first year in final year BDS, I was thrown out of the department. OS was my first posting. But it was fun. We learned. That's how you learn, right?
You need that.
You need to be disciplined and
like
डंडे से मारना पड़ता है.
One book you'd recommend everyone to read once?
How to Win Friends and Influence People by Dale Carnegie.
Yeah, that's a great book. Yeah.
I read it in 2005 and I guess 2005 and I have reread it many times. It changed my life. I told you I am a hardcore introvert, and that book made me open myself and start being an extrovert. So now if I meet any of my batchmates, they are like, this is not the Anand we knew. The BDS batchmates, ये तू कैसा आनंद हो गया? तू पहले ऐसा नहीं था. So they don't recognize me anymore.
इस पे भी एक meme याद आ रहा है.
So you are not the same person anymore, and for the good. It's not that I have got worse, I have got better.
Yeah. Your favorite dental instrument?
ProTaper Gold. I love it. So ProTaper Gold is what we used for root canals, and it's an amazing instrument. I've been using it for the past 3-4 years now since it has been launched in the market. So we have this saying between us endodontists. We endodontists don't invest in gold. We invest in nitai. And ProTaper Gold gives you that feel of buying gold, but in nickel titanium. And it's an amazing instrument. It does beautiful job.
So I'm sure you must have tried it. I mean, almost all the systems out there, but you've again come back to ProTaper Gold.
Yes. So I have been using, so ProTaper Gold is just a metallurgical advancement from the original ProTaper. And I've been using ProTaper since 2009. And I'm stuck to it. I just can't go to anyone else.
Okay.
I've used literally everything on the market, as you said. It's just that something you're comfortable with.
Okay.
It's not that ProTaper Gold is something that others can't do, but I'm comfortable with it.
It's my personal favorite. One dental instrument or equipment which you regret buying or you have stopped using?
Stopped using impression trays now since I've moved into digital dentistry and using scanners now. Okay. Regret buying, I guess there would be a lot because my cabinets are full of things that I'm not using.
One which you can remember.
This is gonna be a tough thing. There are many, I guess. X-ray positioners, which you never end up using. Lead aprons, we never use. I guess everyone has in their clinic, but we never use. I regret buying that. I can't think of any. I'll have to go and open my cabinet and I'll send you a good list of it.
I'll take the X-ray positioner because even I have one. I've never used it. One.
Yeah, and I bought it for good amount of money. And you never used it, right? You buy it thinking, I'm going to use this every time, and you use it never.
Right.
So,
who's your inspiration in dentistry?
Right now, Dr. Mohan Bhuvneshwaran. He is, I'm going to meet him about 2 weeks later. I'm going down to his clinic in Chennai. He's doing amazing work and he's so down to earth, so approachable, such a good gentleman, and he is AACD accredited, which not many dentists in India are. And he's so good at mentoring you that I'm looking up to it.
Wow. And we look forward for your experience.
Surely.
If you were not a dentist, what would you be?
A medico maybe.
Okay.
Would have gone into medicine for sure. Maybe something in the chest or cardio region, but would be in medicine
in the
for sure. Healthcare industry for sure.
Your favorite because you travel a lot, so your favorite dental conference experience?
So something related to Dr. Mohan sir. I just was in Kochi about a month back attending the 7th conference from Academy of Cosmetic Dentists of India. And trust me, the way conferences are held, at least in India, and I'm sure pretty sure globally, is that you have 10-15 speakers coming down taking a lecture, 1 hour each lecture, and then once you're done with the conference, you don't have anything to take home. Right? You're like, okay, I socialized, I met a lot of friends, but what did I take home? What can I apply to my clinical practice from the next day itself, which is very less. Here, the conference was for 3 days, and the first 2 days we had just 2 speakers from the US and Canada, 2 top-notch guys, people who are from the accreditation team of AACD, who were just talking the whole day through the whole process from diagnosis to treatment planning to actual execution to delivery, everything, which was put across to us in the whole 2 days. And then the third day we had Dr. Javier Tapia from Spain, who is a crazy act. He gives you VFX in dentistry that you would have never seen before. It's better than an Avatar movie.
Wow.
He does better than an Avatar or whatever Hollywood movie can you think of. You will see dentinal tubules that you have never thought of. The collagen fibers and the enamel prisms. And the way he taught photography was amazing. I have attended at least 3 or 4 lectures on photography from the best national and international speakers. But within that one day, he taught such amazing things that I was blown away. That experience of that whole conference, how warm and welcoming everyone was.
The way it was conducted.
Organized, punctual, on time. Many things in India are not punctual, right? We are famous for that, right? Everything was on time. It was an amazing experience. And I missed a big Endo conference happening in Mumbai to attend that. And it was totally worth it.
Wow.
So,
and like you said, you had a takeaway message.
You had a lot of takeaway messages. You were inspired, and सिर्फ inspiration से कुछ नहीं होता है, करना भी पड़ता है.
Right.
It's as simple as that. Just getting inspired does no change, right? After 2 days, that inspiration vanishes.
Yeah, motivation is zero if you don't do anything about it.
So it's useless, right?
Right.
So, but we were inspired, and that is the moment I decided, boss, I need to take that next step. I want to get into adhesive and aesthetic dentistry, and that is the moment I spoke to Mohan sir that I want to come under your umbrella and I want you to take me. I didn't ask him, will you take me? I was like, I want you to take me, and I'm literally forcing myself on him. I know he is more than welcoming, but that whole experience made me take that step.
Last one. One thing you wish to change in dentistry in India?
People need to get serious about dentistry. Dentists need to get serious about their profession. I see a lot of people on groups talking bad about themselves.
Okay.
You might be seeing that on social media. A lot of people downgrade our own profession. People downgrade your neighboring dentists. Whenever a patient comes to me with some bad dentistry done, my first point to the patient is, don't tell me the name of the doctor also who has done it. I just want to know when it was done. That's all. I don't need anything else. I don't care who did it. It's not going to make any difference to my treatment plan. So don't tell me that. But respect your neighbor, respect your profession. That is what is giving you the bread on your plate. Get serious about it. Even in masti, if you are saying bad about your profession, it stays with your subconscious mind. Right. Never look down on yourself or your profession. If you look down on yourself or your profession, the whole world is going to look down. You have to create that difference, that I am not the regular dentist that you might be going to. There is something different in me, and the patient will understand that. After meeting you once or twice, they'll understand that this guy takes his job seriously, this guy takes his profession seriously. Right. There are many who don't. There are many who don't take their time seriously, for example. People give an appointment, kal aa jao 7:30 baje. The patient will land up at 8 o'clock. If that is how you give an appointment, the patient is not going to respect your time. In my clinic, everything goes by the clock. 10 baje, matlab 10 baje. It has to be on time. Obviously, there are some unexpected events that happen for which I make sure I apologize at least 5 times to the patient if that happens. But you have to put your foot down and get serious about yourself. And that is when patients will get serious about you. And I've noticed that a lot of this young generation is not serious about themselves and their profession. They take it very lightly. They talk bad about it. They look down on themselves, which is not right. You have to get serious about dentistry. You have to get serious about your profession, which is the most important. Get serious about it.
I've been a part of this generation, so I can see that happening, and even the next generation is coming. Like you said, it's true. It's true for just not our that's sadly the situation we are in, and hopefully we work on it and improve it.
Yes,
and like you said, if you take ourselves, then only the patient will take us seriously.
If you're not respecting yourself, nobody is going to respect you.
Right.
It's as simple as that. Right. You have to respect your time. You have to respect your profession. You have to respect everything that you're doing. Once the patient sees that, they'll respect everything that you do. That is very, very important. Give it that respect, give it that seriousness. Don't take things lightly, because they stay with your subconscious mind, and the patients will get that. The patients will understand that.
Right.
And it will reflect in many things. The patient will not respect your time, your charges, your many things. I don't have patients bargaining with me. Nobody does that. Because they know I respect my work, I respect my time, I respect everything. Nobody even dares to bargain with me. But everyone has that problem everywhere, right? Because you're not respecting your profession, so the patients are also not respecting your work and your profession. Respect it, you'll get it in return, in multiple folds.
Absolutely. So, Dr. Anand, thank you. That was our short first podcast. Hopefully, we'll again have you soon on it.
Sure.
And like I said, right in this episode, we just discussed a few of your things, because you have much more knowledge and much more things, and one of those few dentists out there who are doing so many things and excelling at it. I'm not saying because you are there. I've known you since the last 7 years and I've seen you do every new thing and be at it. You have not given up. So there's a lot to talk. But again, hopefully in another episode. So thank you for taking out time. You have a crazy schedule, like you said, and still you could take out time for this episode. And I think it will benefit a lot of us. It will benefit me personally. And it's always wonderful to meet you. And thank you again. So
it was a pleasure, Arib. Anytime for you.
Thank you. We'll meet soon.
Sure.
Thank you.
हाँ यार कान दुख गए मेरे. ये बहुत क्रेजी लगता है.
वो जो मीम है ना
हाँ,
वो
क्या?
MDS का मीम
क्या है?
वो राज का मीम नहीं है. राज मूवी 1 उसमें वो हीरोइन बोलती है ना कि मैं तुम्हें बर्बाद कर दूंगी. हाँ. तो ये बोलता है मैं बर्बाद होना चाहता हूँ.
ये मैं बर्बाद होना चाहता हूँ.